Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Mohammed Lambert and I am an optometrist. I work at Sophistic Optical Solutions based in Indonesia. How often should one get their eyes checked? For children, I would advise every 12 months or annually an eye test, and for adults, every 18 to 24 months. Just a few tips with regards to your vision. A lot of the time we complain about our eyes being sore because we sit in front of the computer screens for up to about 12-15 hours a day. I know our jobs are very demanding in this modern world with the computer screen, and we experience symptoms of eye strain and constant itching, burning, and a lot of pain. This is referred commonly as digital eye strain or computer vision syndrome. In order to combat the effects of computer vision syndrome, it would be advisable rather to get an anti-glare lens or blue blocking lens. This will really help to prevent that computer screen blue light from affecting the tissue within the eye. Also, another thing is limit your screen time or take breaks in between screen time. I would advise taking breaks every 25 to 30 minutes. A 5-minute break is sufficient, just looking into the distance, taking some time away from your screen. Another thing one can do is using a lubricated eye drops, just to provide that moisture and lubrication to the eyes. It's also important to diagnose any visual problems in kids, especially like between the age of 5 to 7 years old. This is critical in their development and in their learning, as vision is a really important part in learning. So if you notice that your child is rubbing their eyes a lot, or even if you notice any movements with one eye or both eyes going in, going out, it's important to go to your optometrist, let them have a look at it, so that we can diagnose or we can pick up any kind of problems in their visual system, if they need some sort of therapy or if they need spectacles. And also it's important, family history of hypertension, sugar diabetes, glaucoma. All these are genetic and it can be passed down to your kids. So it's important to get them checked out at least once a year with regards to their vision, and obviously with other health professionals as well. So another common thing that I get asked by my patients is astigmatism. There's nothing to be scared about with regards to astigmatism. Astigmatism is just basically the shape of your eye being more oval or rugby ball rather than being spherical, and it can be corrected through spectacles. However, with other corneal aphasias or corneal dystrophies, the cornea is affected and it can be a bit progressive. Optometrists can diagnose different corneal aphasias such as keratoconus, keratoglobus, and there are plenty more. But once these corneal aphasias are diagnosed, eye surgery would be necessary through an ophthalmologist. Hence, it is important to be diagnosed early in the condition before it starts to progress. So astigmatism, some common signs or symptoms of astigmatism would be that one would experience blurry vision as well as smudgy vision, and especially driving at night would be extremely difficult because lights would appear to be brighter than what they usually should be. This can be easily corrected through spectacle lenses, but also if high amounts of astigmatism are diagnosed, then corneal surgery will be necessary. It is crucial to diagnose visual problems in childhood, as this is necessary for their learning. If your kid is younger than 6 years old, then I would advise that you take him or her to an ophthalmologist, which is an eye specialist. What they will do is a cycloplegic refraction, which would relax the eyes and provide or diagnose an accurate prescription.